Will dentistry end up like pharmacy? Is it becoming the next Walgreens or CVS? This blew up instantly. You probably already know why. Let me just read it to you. This is what I posted. It used to be that a dental degree meant freedom. You hung a shingle, built relationships, treated families, and eventually handed your practice to a protege who'd carry on your legacy. Now, most new grads are heading straight into corporate dentistry, and many may never leave. The profession is shifting, and not by accident. With student debt levels soaring past 500,000, dental school curriculums devoid of real-world business training, and private practices selling to DSOs at record pace, the safe route of corporate employment has become the default. But it's a trap. As one dentist bluntly put it, your boss will pay you just enough to kill your dreams of ownership. The parallels with pharmacy are striking. Pharmacists once had cushy, respected jobs. Now they fill quotas under relentless corporate pressure for per diem wages and no benefits. Dentistry is heading there unless the next generation acts differently. So what's the advice from the front lines? First, learn the business side early. Clinical chops alone won't save you. Ownership is still possible, but it requires hustle, risk tolerance, and the ability to differentiate yourself. Patients may not always understand clinical nuance, but they know when they're treated like a number. That's where private practice shines. Patients still crave relationships, especially in an era of musical chair providers and aggressive upsells. Blue-collar patients in middle America can smell corporate dentistry from the waiting room. They don't want 5 referrals or a $5,000 treatment plan for a chipped tooth. They want a doc who knows their name and fixes their problem. Funny enough, the best practice growth today isn't from soccer moms chasing free cleanings. It's from neglected patients finally ready to fix their mouth. Patients who don't care if you're in network, but do care that you won't judge them. Practices that market to this other 50% of the population, the ones who rarely go to the dentist, are thriving. They don't need extended hours. They need empathy, clarity, and results. And while DSOs push expanded hours, many docs have learned the hard way. Weekend appointments are a mirage. No-shows spike, production tanks, and staff hate it. Quality patients, the one with big cases and realistic expectations, come at 10 a.m. on a Tuesday. The rest, let the DSO associate handle them at 8 p.m. on a Saturday. Still, the corporate machines march on. DSOs come in many flavors now, some masquerading as private by keeping the old practice names. Some push lasers and onlays on every patient. Others run like Medicaid mills. The through line, most associate docs report pressure to upsell and the loss of clinical autonomy. So what's the path forward? Own your own practice or partner with someone who shares your values. Drop the worst PPOs. Stop trying to compete on price. Focus on outcomes, experience, and trust. Patients are more discerning than we think, and loyalty still exists. It just has to be earned. Dentistry is not dead, it's just dividing. There's Walmart and there's Nordstrom's. Be the Nordstroms. You won't see everyone, but the ones who choose you will stay. And remember, no one is coming to save you. Not your dental school, not your DSO, not Delta Dental, not the ADA, and not your CE junket. But that's the good news, because if you take control clinically, financially, and philosophically, you can still have the career you dreamed of when you first picked up a handpiece.